Okay, special test of the knee. ACL test. We've got 3 that I want you to know. Anterior draw test. Knee at like a 45-degree angle. You're going to hold the weight onto the foot. You're going to place either side of your palms here, hands behind the back, and you're going to try to draw the knee forwards. And you're looking for positive sign for an ACL tear would be laxity, not pain, increased anterior translation of the tibia. Other test you can do is a Lockman's or a modified Lockman's. Scoot back for me a little bit, Frank. Relax your leg. Try to have them relax the leg. Get the knee into about 15 to 20 degrees of flexion. And again, we're trying to draw forwards the tibia by stabilizing the femur here, and we're drawing anteriorly forwards. And obviously if it stops, you feel a hard pop and a stop. If it doesn't, and you're worried about tear, then you feel that increased laxity translation on tibia. You can do a modified one as well to help them relax. If you have a patient that has bigger legs and you have smaller hands, this works better for you as well. Bryce doesn't have that problem. And then like that, so we're going to do a Lockman's test like that. Got that joking. Pivot shift test is the third one. It's a complicated test. ACL tear, what we're looking for is to pivot and shift basically. We're going to compression load the tibia into the femur. We're going to rotate internally the tibia, and we're going to flex the knee into this position and the hip internally. And what we're looking for is a translation of the tibia forwards. Sometimes what we see is as we come back out of it, the tibia drops back and we hear this clunk. So we're looking for that anterior translation of the tibia on a fixed femur as we go up there, and it's an ACL test. So all of these tests are really laxity or increased translation of the tibia. PCL test, got 3. Posterior draw test, same position as the anterior draw test, but this time we're trying to push to see if the tibia goes backwards on a fixed femur, so it's increased posterior translation of the tibia. We have a posterior sag test, which basically is sitting them in a 45-degree angle like this, looking to see if one of the tibias has sagged backwards, hence the name posterior sag. Because if it has, it would indicate that the PCL was torn and the posterior tibia shifted backwards. And the other one we do is a Godfrey's test, which is almost the same, but we're allowing gravity to hit us. So we're going to hold them at 90 degrees, and we're looking to see if one of the tibias is lower than the other to see if that sag has happened because of a PCL tear. So that's a Godfrey's test. Those are your 3 for that. Meniscus test. These are complicated tests. You can probably video from the side, mate. So straighten this leg. So McMurray's test for meniscus. You're going to go into flexion. You're going to palpate the meniscus with index finger and thumb. What I like to do is do flexed and rotated movement here. Internal, external rotation movement. Sometimes you want to come out into extension, but really I try to keep them in this full flex position. And you're looking for pain at the site of your finger and thumb, basically. And that would indicate a positive meniscus tear, possibly. The other meniscus tear, you're going to lie on your stomach. It's called an Apley's distraction test, compression test. So we're going to go to 90 degrees. The goal is to basically hit the tibial plateau down onto the condyles. So we are going to, same as the McMurray test, but we go at 90 degrees. We're going to compress down and try to rotate onto those condyles, basically try to irritate that meniscus. If they have pain with that at the site of the meniscus, that would be a positive sign. And if they have decreased pain when you actually distract, so if I go ahead and pull the tibia superiorly and then rotate away from it, they should have a decrease of pain. So the distraction part is a positive sign, is actually less pain. Compression, more pain when we compress and load down. So pain during compression, Apley's compression, less pain during Apley's distraction when we pull up and then rotate away from the meniscus and try to open up that tibiofemoral joint. Flip round. So we've got varus valgus test. Varus valgus test is a simple MCL test. We do it at 0 degrees to test the whole joint capsule with the MCL, and we're going to try and basically do a medial movement of the knee inwards. You shouldn't get much movement there unless there's a tear to the MCL. Then you're going to go to 15 to 20 degrees, and you're going to try to see if there's any motion. So we're looking for pain and laxity, so increased range of motion into valgus for a positive MCL test. For the LCL, I like to bring the leg like this side, so you might want to flip around this side, sorry. And I put the leg against my body and basically palpate on the medial side of the knee, and we try to go into varus, 0 degrees, again 15 to 20 degrees, relax, Bryce, and we try to open that joint up. And again, we're looking for, so his stop's really good, but if it was lax, we're looking for an LCL tear, increased laxity, increased pain. The last few are Clark test, which is an Clark test is a, it's also called the patella grind test. It's testing for chondrum malacia, which is the cartilage underneath the patella. Go ahead and contract your quad, Bryce. And what we're looking for there is like grinding underneath the patella, crepitus, which is that crunching pain, or just pain beneath the patella joint, or the patella femoral joint. So contract, hold, good. And we're just trying to compress down above the superior. See that little bit of crepitus that you felt there? But we're looking for pain provocation really there for that chondrum malacia injury. And then apprehension test is testing for previous patella dislocation. So I'll go over to this knee. Most patellas dislocate laterally. So all we're doing is getting the knee to relax and we're slowly guiding it towards that sort of previous dislocation point. And if they contract their quads, so go ahead and contract your quads, or they feel apprehensive, so they say stop, that would be a positive sign, saying that they don't want you to push that patella into the position that they dislocated it in. The last two tests are swelling tests. So they're called palatable patella test and sweep test. Basically, you're cupping the superior part of the patella and you're pushing down at the top of the knee to see if there's any rebound of fluid, any difficulty actually palpating the top of the patella because there's a fusion, which is fluid within the knee joint. So we're just kind of cupping that whole knee to see if the swelling pulls down, pushing down, seeing if there's any rebound of fluid, not able to palpate the patella correctly. The other one is a sweep test, which is basically where you just kind of sweep alongside the lateral aspect of the knee, and then you would sweep alongside the medial aspect of the knee to see if the swelling is pushing over from one side to the other into the bursa space and into the sort of, you know, seeing that swelling push through to the joint capsule. So we'd sweep medial side, we'd sweep lateral side to see if that swelling flows over. So those are palatable patella test and sweep test.